Next, we have something very, very exciting. This is an innovation by Dr. Prasanna Venkatesh Ramesh, but he is unfortunately had a small accident and he is unable to come. So we will be showing you how the 3D metaverse, the virtual reality metaverse is already here. And you will experience the 3D metaverse of virtual reality in front of your eyes. There is Mr. Tenzing here with the 3D printed models in his hand, virtual reality headset also with him. We will be able to show you the virtual world in front of you. Okay. Any volunteers? Okay, first have a look at the 3D models. Volunteers for putting the headset on can please come forward. Dr. Ramna can start the presentation. Volunteers can come forward to experience virtual reality.
Thank you, sir. So let's get into the metaverse of smartphone pedagogy and patient counseling tools. And there is it's not the only method, but we will look into that. So there is a extensive energy and dedication which is there for this presentation, and I'm going to share you the energy from Dr. Prasanna's voice. So if at all you have any lag, or if you feel something is missing, like I just came through everything in yesterday's evening only. So we will be demonstrating you whatever is there, and I'm there as a part of this Mahatma moving images for the past 2.5 years, and we are looking into the presentations here. And this is a glaucoma module which has been published in IJO in February 2022 and June, and now whatever we are experiencing is real-time images, and it's going to be animated videos which is going to you, and it is always there for you to visualize what is happening. And this is the normal anatomy of the iris process, which is be animated, and here you can see the peripheral anterior synechiae in the left. So once the animation is there, you can learn it in a real time, what is happening inside your eye, and you can learn it from the start. So we believe that we will integrate everything with real-time videos, and so we are here to demonstrate you the iris processes in the right. You can see it in the video, and then there is a peripheral anterior synechiae which is there, and this will cause the rise in the intraocular pressure, as you all know. So we will give you the metaphorical outview of what is happening in acute angle closure attack. So right now you can see there is a iris lenticular touch, and there is a closure of the angle, and so that the aqueous is not draining properly, and there is an intraocular pressure rise. So we will give you a detailed scenario with the real-time video. This is a Van Erick's grading, and just giving a VH1, and then you can see there is a YAG PI being done, and real time there is a leak of aqueous from the AC. So when you look into the surgical scenarios, there is always a part which will be looking post-operatively. We will be looking at only at the bleb, but not the ostium. That is actually a very important aspect of gonioscopy, which should be done post-operatively. You will be looking at a patent ostium on the towards your right, and there will be a blocked ostium in the left, which is there. We will always tend to miss such things. We can easily demonstrate in a real-time video for surgical residents. Then if you look into this laser training, and we are going into the metaverse in a different dimension, we will give you the real-time anatomy, and then when you go into the angle structures in an animated way, which will give you certain aspects which we used to tend to miss in our clinical learning. Here you can look into the eye with normal angles, and then with the appositional angle closure, where you can indicate with the arrow marks, and then you can go to the organ laser, peripheral iridoplasty, how the appositional angles are being opened by the organ laser. And here, this is just a front-on view to demonstrate what is happening. There are 24 shots which is placed over 360 degrees, and this is the side-on view. As you can see, when the laser is being applied, and there will be opening of the peripheral anterior synechiae. It can be beautifully demonstrated with the animated videos and learning. So we have published an IJO April 2022 edition of what is the 3D learning can give to a resident from the MBBS to till the person is going to become a resident. They need that anatomy should be learned in a very structural and conceptual way. And this 3D printing models, which has been designated in Mahatma moving images, like we can give you the real-time images. So here's the circle of Willis, which has been printed, and you can see it in your hand. And this is a dural venous sinuses, and all this been available with us, and we can give you the experience for you. And this is our color fundus photograph, which is like we have a hologram and 4D visualization techniques also. What we had did is like we incorporated the real images, fundus images to the 3D model, so that we can learn at the simultaneously the normal fundus, and then along with that you can have the autofluorescence and infrared in the same time, starting from the first year residency itself, so that it will give them a real time scenario of understanding what is happening inside the retina. You can give this is the flecked retina, and there is autofluorescence and infrared also, which you can demonstrate in a real time. All these images are not animated, everything is a real patient's image, and which we are incorporated in our technology. So this is again there is a color fundus photo of the clinical scenario and the myelinated nerve fiber, which is demonstrated in the infrared fundus image also. Same for the splinter hemorrhages. And if you see this neovascularization, if you see it in a color fundus and you show them in the infrared, and you can even demonstrate a fundus fluorescent angiography. So right now we are going into the metaverse, into the depth. So this metaverse concept has so many components, like all the innovators are doing so much for imaging, and what we can do is like we'll integrate everything into a same channel to give you a 4D experience. So this concept is actually came to mind for Dr. Prasanna with Iron Man's understanding of what is happening in the Avengers scenario. So we have a app, smartphone application for you, IMG AR and IMG Max. These are the QR codes for you. You can real time, you can start using the application, and we have scenarios also. So this is how the instructor is demonstrating the 3D image, which is like an analog, which is printed, and you can use with the app, and you can demonstrate what is happening in the eye. Right now, from the day one, they can learn what is inside the eye from a retina surgeon's view. Just imagine what is happening to a residency training, if at all they get a thought process of from the anterior segment to the posterior segment in a real-time view, so that they are learning of anatomy and what the surgical skills they are going to acquire. It will definitely have a serious impact what is happening there. So we can demonstrate with the app, a smartphone application, that itself is enough. So we can construct the images with real-time image, which we can acquire with the confocal image in our center. And you can see the angle structures here. You can really construct that images with the real-time gonioscopy. Again, you can see the normal fundus photo, which is autofluorescence and IR technology can be combined within the same image. So it's all been published in European Journal of Ophthalmology, IJO. You can go through that. And here, this is the best part, which you are going to experience now. Our chief of animation is there, Mr. Tensing is there, and he will be demonstrating you how to feel that in a 4D way, to zoom it. You can see what is happening inside the eye. You can pinch and you can analyze all the aspects of eye, which is going to be the future of patient counseling and students education. Whatever we are leaping towards in artificial intelligence and machine learning, this is going to be a definite impact on residency training. As again, there is a counseling part which we always struggle to interact with the patient, what is happening inside the eye. All this can be revolutionized if we can do such kind of demonstration to the patient and their caregivers. So this is going to be your demo video after this session. So it has been published in IJO, the 4D imaging and metaverse concept. So what will happen if a patient comes to you with a diabetic retinopathy? We will acquire all the images, and of course we'll do a OCT, and we'll feed it to our system, and the software will process that, and it will give you an image. The image it will be given in such a way, it will be giving you the complete scenario, all of the OCT in a structural manner. Even all the slices can be demonstrated to you. and then the patient can learn what is happening in their eyes. You can give them a complete brief scenario. So this is the 4D model imaging examination of the retinal diseases. We can demonstrate the surgical residence in a better way. This surgical simulations is going to be is there for you, but for Dr. Prasanna had got this concept from Melbourne conference when he experienced all those things. So after that, when he started doing this eye stent mix procedures, he came to know that the learning process will definitely improve better when you have that experience of doing it in a virtual reality way. In this video, you can see there is definitely there is a device which is like going here and there, and you have to take multiple steps to position the device, which can be overcome if we have a learning experience in a dimensional manner, which can be given only by the augmented reality, which we are going to demonstrate here. This is Mr. Tensing, and he has the VR device and he is utilizing it. Right now, I will show you the part which is very important. Like, you can install, and if the device is lighting to green, you are in the perfect path to understand where you are placing the stent also. So this can be tightened in such a way, and right now you can see nicely the stent is being placed there. So this is how the surgical training should evolve, what we are seeing, and this is patented now by Mahatma Center of Moving Images, and it's been published. So when a child can introduce, and child is being experienced in such a way, we can go to different dimension. That is the concept of metaverse, and metaverse is going to definitely revolutionize what we are seeing as a clinicians, and we hope that we'll take it more experience and all the energy forward to the next generation. And Mr. Tensing is here to demonstrate to you what is there with us. And thank you for the great opportunity. And we have models also in the app which you can use to even train from school level till MBBS level. You can utilize all those in a certain manner and in an organized way in IGMG Max application. So thank you all for the opportunity. It is wonderful to be here, and I travel a lot to be here, and I'm happy that I share some of the energy of Mr. Prasanna and John sir and Prithvi sir. All of them had given us so much of inspiration, and I'm just carrying the same energy forward. Hopefully when I am here next time, I'll be giving my own innovation here. And thank you all. Thank you so much. Thank you.
Thank you, Dr. Ramanan. We have Tenzin over there who will actually give you a demonstration on the hologram that they've worked on. As the time is out right now, so